Thank you, folks. Next slide. So we'd like to acknowledge the team and the land acknowledgement. So the team is Dr. Mona Lufti, Angela Underhill, Mina, who you also have on your team, Dr. Ashley Lancome Duncan, for all her support with the slides today, all the research assistants, co-investigators, collaborators, students, and volunteers, the partnering clinic, the community-based partners, and of course, the participants who took the study for the CHIWO study. Next slide. So Trans Women and HIV Research Initiative and Collaborator Research Projects. This came out of a study called CHIWOs, which many of you will probably be familiar with. So I'm not going to go into too much depth about it. And in that study, we looked at the social determinants of health and mental health among trans women living with HIV. Then we had a national trans team that we started to build together, and then we came up with TEACH, which is Transgender Education for Affirmative Competent HIV and Healthcare, which Carmen will talk about. And then Carmen and myself and some other team members came up with Transcending Love, for short T-Love, looking at African Caribbean trans women and talking about self-love and acceptance. On a separate project, we started to look at developing hormone therapy satisfaction with trans women living with HIV and without HIV, and the studies between Montreal and Toronto. Next slide. So from CHIWOs, we pulled the trans women and HIV data, and these are just some of the data stats that we have. So when we looked at trans women with HIV in Canada, we saw that they were experiencing very high rates of violence in childhood and adulthood. We saw experiences of social isolation and transphobia, experiencing less access to HIV-related care compared to cis women with HIV. Having need to access many different types of services, so very trans-specific mental health, substance use, income, employment, in addition to HIV care. And then compared to cis women, a smaller portion of trans women with HIV in Canada had paid employment. So you'll see here, it's 11.3% of trans women versus 22.7% of cis women. And then report to stable housing, 73.5% of trans women had stable housing versus 90.0% who had unstable housing. Next slide. When we look at the mental health characteristics, we look at sort of how this would break down. We had like 44.2% had clinically significant depressive symptoms, 45.3% had clinically significant PTSD symptoms, and this stemmed both out of most of the folks who were not born in Canada, so they had experience in PTSD, and then compounded with coming to Canada and experiencing higher levels of PTSD due to transphobia, and of course, living with HIV. Mental health and health-related quality of life. So we saw for trans women, the quality of life was very low in comparison to cis women. Associated with less frequent depressive symptoms. So we saw resilience as a big factor here. When we talked about resilience, we saw not only folks having to deal with all the issues of social determinants of health, but having strong levels of resilience. Sexual relationship power, so the dynamics of folks live in relationships where they might struggle with partners who are may have more power over them. Social support, very lack of social support. So there's not a lot of social support for trans women living with HIV. There's a lot of support groups, but a lot of them don't involve or have access for trans women. Less difficulty meeting housing needs. So again, this is of course no news to folks with the cost of housing needs here. It's quite expensive, and never having used injection drugs. So a lot of folks have, experience with drug use or injection drug use or different types of drug use. And then when we look at symptoms associated with depression. We saw internalized stigma, very high experiences of violence, and many other founded with this. Next slide. So this is the project Teach, which I'm pretty much going to hand over to Carmen for a bit to talk about. And again, it's transgender education for affirmative and competent HIV and healthcare. So Carmen, you can take
Okay.
this.
Great job, Yasmeen. So Teach is actually Yasmeen's brainchild. So Yasmeen has been doing Trans 101 training for many, many years. I'm not going to age you, has trained thousands of people. And what we wanted to do was address these barriers to sexual health care, which are stigma actually experienced while accessing care by trans women, and also a lack of provider knowledge and experience about the needs of trans women living with HIV or around HIV prevention with trans women, and a lack of trans-specific services and a real cisnormativity, so an expectation, an assumption that people are cisgender when they're accessing healthcare. And we know that for trans women to realize sexual health and rights, they need trans-positive, trauma-informed care, autonomy and choice, and trans affirmative programming. And so we basically extracted information from Yasmeen's brain to develop this program, trained peer researchers who are also trans women in Vancouver and Montreal, and we delivered workshops to healthcare providers and social workers in Toronto, Montreal, and Vancouver. And the data is still being analyzed. But good news, it looks like we improved knowledge and competency to provide care for trans women living with HIV. Stay tuned. Something else we wanted to just briefly talk about, we're happy to share the Transcending Love cards, is what I just described with Teach is a structural level intervention. So an intervention that is trying to change the systems in which people access to get care. But when we, Yasmeen and myself and others from Black Cap and Maggie's Sex Work Action Project and 519, when we spoke to trans women of color and African and Caribbean and Black trans women specifically for this project, Transcending Love, about what HIV prevention needs people had, they said, we're sick and tired of people talking to us about HIV. You need to tell us how we're supposed to love and care for ourselves in a society that hates us. And so we said, okay, we're going to listen. And we developed this workshop based on self-acceptance and self-love, as well as community sharing of love and support. This really highlighted the importance of hope, the importance of creating spaces for people to share stories of how they realize self-love and manage stigma. And we created this beautiful deck of cards. Yasmeen has, I think, shared this deck of cards with probably many, many trainings across Ontario and across Canada. We've shared it at conferences, World AIDS Day events. We have a PDF if you want the deck of cards that are the artwork. It included mirrors where people wrote messages of self-love to themselves in handheld mirrors, and we have photos of those. Anatomical hearts, as you see in the middle, where people wrote feelings and strategies that they use to feel self-acceptance, and actual affirmation cards that they wrote to one another, to other trans women of color, messages of support. I love you, you're born for a reason, know your rights, things like that. It's very powerful. And we're actually working on an article about how we need to use love and hope in research more, and a book chapter that Yasmeen is part of. And so how we, evaluating our impact, we have some publications. We don't have all of them up here because there's a time limit and a slide limit, but there's lots of articles. There's been 2 conferences, presentations all over the world, workshops with health and social service workers and providers, transformative art, and a video series. This is really quickly, TWERI, which is the Trans Women Research Initiative through Women's College Hospital, where Yasmeen is working, had a 2018 conference with 40 folks. And look at that, it doubled in 2019 with 80 folks, really highlighting community and service provider dialogue, trans voices, and expertise. And we have this wonderful video series. I would love if everybody wanted to use it. So this is, I have a Canada Foundation for Innovation Lab, and we sponsored this, but it's completely led by Yasmeen. So Yasmeen is directing conversations with trans women of color and trans women newcomers about resilience. There's one specifically on how they want to be treated accessing health and social services. They're all on YouTube. You can also find links on my website. I'm happy to share this, and it's on YouTube so everybody can use them. I actually use them in my class. And what have we learned? Trans women should lead the direction of research. We need more strengths-focused research, peer-to-peer models, more interventions, and obviously the limitations which Maluba and Ahmed started us off with. We need the money, especially when we're working with smaller numbers of people. And we need more outreach to, say, rural folks. And there also needs to be more institutional support nationally, not just in Toronto. So when we're trying to teach in other areas, there really needs to be institutional support for trans women in every place that we need to be offering teach. And that's it. Did we beat the time limit? It's amazing.
Thank you very, very much, Yasmeen and Carmen. That was really inspiring. Thank you.